Hello everyone, welcome to the YouTube channel of Shree Swaminarayan Physiotherapy College. I am Dr. Dhara Desai, Associate Professor at SSPC. In this video, I am going to show you special tests for pediatric hip joint pathology.
So the test is autonomous test for checking the congenital dislocation of hip in pediatric patients. In this, the baby will be in the supine position, examiner will be facing the legs of the patient. Examiner will flex both the knees and hip and will go for abduction and external rotation of both the hips, keeping the thumbs on the inner side of the knee and hip, thighs, and keeping the fingers on the outer side of the thighs. And then the examiner will try to put some pressure on the greater trochanter from the fingers. If the examiner is hearing any click, clunk or jerk in this range, then it is the positive test which says that the hip was dislocated and now it is reduced, and after this sum, more range of abduction can be achieved. Next test is Barlow's test. Barlow's test is a modification of Ortolani's test, and it can be done for checking the developmental dysplasia of hip, again in the pediatric patients. Okay, so in this, again the patient will be in the supine position, the examiner will flex both the hip and knee, and then will go for external rotation and abduction, same as in Ortolani's test. The Barlow's test first part is same as Ortolani's test. The examiner will try to give some pressure from the fingers towards the greater trochanter in forward direction, and will hear, if hears a click or clunk sound, that is showing that the first part of the test is positive. And then by the thumb, the examiner will try to give backward pressure near the inner part of thigh, and again if the hip is going into dislocated position, then it is the positive test, and then the examiner will repeat the same thing on the other side, giving forward pressure from the fingers towards the greater trochanter and giving backward pressure from the thumb near the inner part of thigh.
Thank you for watching. Like, share and subscribe for more videos.